on the floor to get from one place to another, and they feel kind of lost and overwhelmed.
I do think there's a strong sense of ownership. I think people feel this is their hospital. And what I like, most of the people live here, work here. You know, it's your friends and neighbors taking care of patients, which I think also makes a difference.
The Indiana region is home to many successful businesses and organizations like Indiana University of Pennsylvania, Diamond Drugs Incorporated, S&T Bank, and IRMC that provide opportunities and employment to the region.
IRMC means local ownership. People in town who feel invested in the community. Most of the people that work here live here. I think it's the second largest employer in the county.
I'm really proud of the fact that we've been voted a best place to work 15 times by our employees, including Fortune 100 and best place to work in healthcare, which is national. So, I mean, that's to me what it's all about, because, you know, I believe that as employees feel like they're treated, that translates into the patient and family. And so, you know, building that culture was probably the biggest thing we had to overcome.
Keeping healthcare affordable is important. To avoid merging with a large corporate chain, but to also share and control costs, IRMC has proposed an affiliation with the boards of directors of Clarion Hospital and Punxsutawney Hospital for early 2015. Though not considered a merger, this new step provides IRMC with the opportunity to expand the network of specialty physicians, improve access, and most importantly, remain independent with local governance and boards.
I think the overall landscape's going to change, and I think our ability to expand will continue. So challenging times create opportunities, and we're looking for those.
Some of the local hospitals that have been involved with some of the Pittsburgh hospitals have not fared all that well, and they suffered economically as a result. But I think that maintaining its independence has been one of the crucial factors in the success of Indiana Hospital.
You know, it's a safe place that everyone knows they can go when something bad happens. So I think there is a lot of pride in the place. And I don't know if that was true 30 years ago when I came to town, but I really kind of get that feeling now that people feel that it's their hospital.
At IRMC, you'll be treated like one of the family.
When I came down, I just saw an organization that had so much potential and great people and a great market to be in, and the proximity to Pittsburgh, the opportunity for demographic growth, and certainly the university and seeing some banks headquartered here all really spoke to you know, the opportunity. And so we came down and interviewed, and you know, they were fortunate enough to ask me to come, and so that was in February of 1999. And, you know, we have 5 children. It's been a wonderful place to have a family. And when I established the 100-year Centennial Committee to try to do, you know, the best that we could to celebrate, geez, oh man, I mean, this is quite a milestone. And, you know, when I first came to town, I would say, you know, a number of encounters would be negative as I was out in the community, and that really has totally flipped. I mean, you know, I'd say 9 times out of 10, and I rarely go anywhere without somebody sharing their experience, you know, at the hospital with me, from just the most humblest of beginnings to really growing and being what it is today. It's more than just a perception and a feeling. I mean, the numbers bear out that we clearly have, you know, changed in our image and reputation. And this transcends any person or transcends any even group or generation. I mean, it is because of the hard work, sweat, sacrifice of generations before that give us the chance to remain independent today. I mean, we think of boards that were wise decades ago, and doctors and nurses and staff that have worked so hard. And I'm really proud of the fact that we've been voted a best place to work 15 times by our employees, including Fortune 100 and best place to work in healthcare, which is national. So, I mean, that's to me what it's all about, because, you know, I believe that as employees feel like they're treated, that translates into the patient and family. Probably going to be expanding in terms of vascular cardiology. I do think the whole IT over the next 5 years will continue. We're on our journey to fully electronic medical record. You know, we're on that journey now, and so by the end of the 5-year period, I'm sure we'll have a fully integrated medical record, and that is a powerful thing. We have to be cutting edge in what we're providing, and so I feel we've done a good job of that. It will be good for patients, no doubt about it. We'll probably be asked to do more, not less, as long as we're independent, to really care for our community, because we know that we are a high-quality provider. Almost any metric you want to look at, we're very, very competitive. I feel like the community feels like they own Indiana Regional. The biggest thing that I would say that we were able to do was to have people believe in themselves, that they could be the best hospital in the country. So we'll look forward to trying to keep everybody moving forward in this next 100 years.